Senate Public Health and Welfare Committee is now called to order. First up, we will open up the hearing on Senate Bill 274. And with the Revisor's Office to give us an overview of the bill is Jenna Moyer.
Good morning, Mr. Chair. Thank you, members of the committee. Senate Bill 274 relates to the practice of naturopathic doctors, and it broadens the scope of their practice. I'll go through sort of section by section. The first section would be a new section of law, and it would specify the procedures and the actions that a naturopathic doctor can perform, which would include performing examinations, ordering diagnostic imaging, prescribing or administering certain foods, food extracts, human cellular-based products, healthcare, nutrition counseling, fertility counseling, dietary therapy, biofeedback, as well as durable medical equipment and devices, and these professionals could also prescribe, administer, or dispense prescription-only drugs as defined in the Pharmacy Act, as well as testosterone. They could do minor office procedures and provide naturopathic care to pregnant physicians, as well as utilize different routes of administration, and utilize non-diagnostic ultrasound to perform services. And subsection B specifies the actions that a naturopathic doctor would not be allowed to perform, which would be surgery, labor, delivery, as well as ionizing radiation, using anesthetics that are general or spinal aesthetics, as well as interpreting diagnostic imaging, and then as well as prescribe, administer, or dispense any controlled substances not authorized by this act. Section 2 specifies that a naturopathic doctor who does prescribe drugs pursuant to Section 1 would be required to record each prescription in writing, only utilize prescription drugs or recommend them when they have the adequate training and experience to do so, and then register with the USDEA. Section 3 specifies the practice of naturopathy shall not include the following persons, and those would be individuals who are supervised by naturopathic doctors consulting from out of state, or if they are another practitioner of the healing arts practicing pursuant to the delegatory authority of naturopathic doctors. Section 4 specifies that naturopathic doctors are required to maintain records in writing for each patient, as well as keep those records for a minimum of 10 years from the date they provide the service. Section 5 is a severability clause, so that if any provision of this act were to be held invalid, that it would not affect those other sections of law. Section 6 is the definitions from the Pharmacy Act, and it just amends, it does provide some technical updates, as well as amending definitions related to naturopathic doctors, and that is the bulk of this bill. And then the remaining sections, I believe, just are conforming amendments, and they relate to, addition to fees related to the licensee, as well as other professional judgment that if a naturopathic doctor were to violate the terms of their profession, that the discipline, it's the discipline for naturopathic doctors. And I'll be happy to answer any questions.
Jenna, thank you for the overview. Questions, committee? Senator Rochelle.
Thank you, Mr. Chair. I see that this was introduced on the Assessment and Taxation Committee, but do you know who introduced it?
I don't know off the top of my head, but if it's not on the LI, then I can look it up for you. We try to upload those, but I can get that to you. And I will note that this was introduced last session, so if this committee were to pass it out, it would need to get updates for the supplements in yours.
Senator Stephan.
Thank you. I might come with a couple of questions, if you don't mind. On page 1, new section 1, part 2, to order diagnostic imaging studies. But then help me understand how that ties over to, it has to be done by appropriately licensed and qualified healthcare professional to conduct the imaging as well as interpret the results. Okay.
Okay. Thank you, Mr. Chair, Senator Stephan. This would mean that the naturopathic doctor could say, hey, you need an x-ray. And then the x-ray technician would give them the x-ray, be interpreted by the appropriate person to do that. But they could request that the patient get this diagnostic imaging.
Does it mean that they would then have to consult with the person who could interpret the exam?
Thank you, Mr. Chair. Senator Stephan, I don't know that it would require, be a mandatory that they would have to consult with them, but I believe that's pretty common practice when a physician would order an x-ray that you would then check back in with the person who interprets it in terms of medical record sharing and appropriate steps to take after that.
Okay. I just can't tell whether this is granting them the diagnostic capability of these exams.
No. Excuse me, thank you, Mr. Chair. In subsection B, that is one of the specified activities that a naturopathic doctor shall not. Administer, conduct, or interpret the results of diagnostic imaging studies except as authorized by this act.
Okay. Secondly, if I may, on further down part 4, can you help me? I'm sorry, but I didn't get KSA 65-1626 looked up. Can you help me understand what this prescribing
Yes.
parameters would be, please?
Thank you, Mr. Chair. Senator Stephan, I believe that's one that's actually in the bill. 1626. And a drug means, and it's a very long definition, but generally things recognized in the U.S. Pharmacopoeia, articles intended for the diagnosis, cure, mitigation, treatment, or prevention of disease in humans or other animals, articles other than food, intended to affect the human structure, and it goes on for a few other things, but it's on page 5. It would be subsection T, it'd be line 32. That's the definition referenced that a naturopathic doctor could prescribe. This is an inclusive definition and does not specify drugs that are not allowed to be prescribed. This definition would, yes. But there is the limitation in subsection B that in new section 2, B, only prescribe medications when the doctor has adequate education, training, and experience to safely manage the medical regimen, but it's not specifically listed in that statute. Thank you, Mr. Chair. Senator Stephan, that is not defined in the bill. However, subsection B, it specifies that a naturopathic doctor shall not perform surgery.
Committee, seeing no further questions, we will now move to proponent testimony. We only have one proponent with us today. That is Dr. Laura Roos, President of the Kansas Naturopathic Doctors Association. Dr. Roos, I hope I spelled or pronounced your last name correct. So if you wouldn't mind just trying to keep your testimony within 5 minutes, somewhere along those lines.
I'll do my best. Okay.
Thank you.
Good morning, Chairman Hildebrand and other distinguished members of the Public Health and Welfare Committee. My name is Laura Roos. I'm a licensed naturopathic doctor practicing currently in Overland Park, Kansas. I am the president of the Kansas Naturopathic Association, who are the original introductions of this bill. On behalf of the association, my current and future patients, and as a small business owner, I'm here asking for your support of SB 274. SB 274 includes proposed legislation that includes to update areas in our current statutes that allow for interpretive confusion. However, some of the legislation that was brought up are including those things that we are already doing. Like we are already currently ordering labs, we're already currently performing physical exams, we're already currently licensed in Kansas to diagnose and treat. This is also involves an update of our disciplinary regulations and a scope expansion to include authority for legend drugs and testosterone. So that includes only non-controlled substances and excluding testosterone. To answer your questions, Senator Stefan. Naturopathic doctors are in high demand in Kansas. There is a current medical shortage. It's been exacerbated over the last 2 years given the recent medical issues. Hospitals, primary care physicians, and specialists are short-staffed. Physicians and nurses are facing burnout, but patients still need care. We, as naturopathic doctors, are hoping and asking to be involved in the patient care of Kansas. We're asking to be part of the solution. We are already licensed, we're already ordering imaging in labs, we perform physical exams. We also refer regularly and collaborate with our medical provider specialists when needed, especially on complex patients. Unfortunately, currently, I am required to refer for basic prescriptive management that I am trained to manage, and I'm happy to manage. I have training in natural therapeutics as well as the conventional medical standard of care. There are instances when the best patient care necessitates pharmaceutical agents, and you can see on page 2, I list some instances of cases that either I or members of our association have encountered that require referrals to other providers for management of care. This is especially problematic for conditions that require urgency. So for example, strep throat, a common condition diagnosed by primary care providers, we are trained as naturopathic doctors that intervention with medications, especially penicillin, will prevent complications, serious complications in kids, such as rheumatic heart disease, which is the #1 cause of heart disease worldwide. Another example is a sexually transmitted infection. I, as a naturopathic doctor, am performing orificial exams within my scope. I can screen for sexually transmitted conditions. I can order testing for chlamydia. I can get the results from a lab company, and then I contact that patient after reporting it to the Kansas Department of Health and Education. And then I'm asking that patient to visit the nearest walk-in clinic for an appropriate round of doxycycline so that they are protecting their future fertility and their partners. When 10% of Kansans are avoiding care due to cost, this is a problem. This is a delay in care that decreases the ability and availability and the treatment for the patients. I'm also trained to manage basic medications such as hypothyroidism and thyroid medications for hypothyroidism. Currently, I'm diagnosing a patient with one of these conditions, recommending thyroid medication, and then referring them on to an endocrinologist or primary care, which can be a delay in weeks, if not months in care. As a naturopathic doctor, I'm also trained in natural dietary and lifestyle interventions for conditions like diabetes. Kansas currently has 11% of its population with type 2 diabetes, which is higher than the national average. Naturopathic doctors have effective management via lifestyle and dietary interventions, which is more effective than medication management. When patients implement these changes, often they need, based on their labs, a reduction in medication such as metformin. And unfortunately, at my request, this patient is required to see another provider for that appropriate management, even though I'm trained to manage it. I'm here to ask you support so that naturopathic doctors can provide this need and provide the ability to practice consistent with our training. I'm also a small business owner, and I'm excited to provide jobs for Kansans. I currently have 5 naturopathic doctors and 8 support staff at my clinic. I have a goal to expand further westward, but recruiting and moving westward is difficult with the current significant limitations on scope. The statutes currently limit and discourage naturopathic doctors from moving to the state when there's other states with greater authority. This keeps the profession in Kansas small and in very high demand. My clinic has seen nearly 10,000 patients in the last 7 years, so there is a huge need and demand for what we do. Unfortunately, the current scope is driving naturopathic doctors away, even those that have been here. And included in testimony is those who have left, including, unfortunately, our immediate past KNDA president. It is strange to me that those will lobby against us when hospitals and conventional care actively recruit us. Naturopathic doctors offer unique value to the conventional care practice. Kansas University Health System until recently had a naturopathic doctor on staff, and Advent Health, one of the largest healthcare providers in Kansas, currently employs a naturopathic doctor. Those opposing Kansans' access to naturopathic medicine will likely state that our proposal creates public health safety concerns, that our training is inadequate, and that they are the only providers capable of delivering this care. I'd like to take a moment to address these concerns. Regarding safety, the American Medical Association, Kansas Medical Society, and the Kansas Naturopathic Doctors Association agree the practice of medicine should be safe and effective. Since initial regulation by the Kansas Board of Healing Arts in 2003, there have been 0 board actions against naturopathic doctors involving direct or indirect patient harm. The only incidents have been unrelated to patient care. Many states currently have full prescriptive authority for naturopathic doctors. The safety of these doctors in states is well demonstrated. A legal database of 4 states in the Pacific Northwest show no judgments of malpractice against NDs since the database was started in 1988 through 2020. You can also see on page 4 in Appendix C that there are lower rates of board complaints in an exemplary state, Oregon, with full prescriptive authority. Naturopathic medicine is documented and safe in Kansas and in states with full prescriptive rights. It's not only safe, it's effective, and I've included studies on page 4 demonstrating the cost effectiveness and effectiveness of naturopathic medicine. Regarding the training of NDs, naturopathic medical training is organized differently than that of our allopathic and osteopathic counterparts, but it is no less encompassing and rigorous. It parallels that, as you can see on page 5, of allopathic and osteopathic medical students. You can see on the chart on page 6 the credit hour comparisons during schooling from exemplary 2021 programs of NDs versus MDs versus DOs. And all programs include basic sciences, clerkships, and therapeutics, including pharmacology. On page 7, you can see that naturopathic doctor programs are far beyond observation and have significant hours in primary care training, especially compared to patient contact hours from medical programs. Residencies is another point that my opposition will bring up. Residency discrepancies are often compared for naturopathic doctors and our conventional care counterparts. The naturopathic school programs require early exposure to clinical care, and a lot of times these, to be honest, the discrepancies are because conventional care counterparts, their residencies are funded by federal funding. Naturopathic doctors, our funding for our residencies are private. I'm a proud business owner and the first doctor to have a naturopathic resident in Kansas, but I can tell you as a business owner, this was privately funded. This is why our naturopathic programs are structured differently. We integrate in our programs earlier patient management, while our MD-DO counterparts are primarily observational in their MD training, and then they go on to complete residency for direct patient management and clinical experience for their specialties and subspecialties. Naturopathic doctors do not specialize. We graduate ready to diagnose and treat and provide basic care for our patients. We refer for surgery, colonoscopies, for inpatient care, chemotherapy, and other specialty management. We do not manage a patient in hospital. We're not performing C-sections. We're not even asking for that ability. What we have in front of you and the issue at hand is for us to be able to practice consistent with our training so that we can provide better care for Kansans. My opposition may state that NDs have less training than MDs and DOs. This is why we are asking for scope consistent with our training. We're not asking for scope beyond that we are trained for. We're not asking for scheduled drugs. We're not asking for opioid management. We're asking for legend drugs and testosterone, as well as outpatient care that reflects our current training. Naturopathic doctors have the training, the ability, and the desire to provide unmet needs in Kansas. I encourage you to evaluate my opposition's references and refer to our professional association, the American Association of Naturopathic Physicians, for credible information. I encourage you to read the letters of testimony in this packet, including letters from physicians, pharmacists, patients, and naturopathic doctors, including their support of SB 274 and frustrations with the current limitations. With conviction, confidence, and passion, and on behalf of current and future patients, which will be the true beneficiaries, I implore you to support this legislation.
Dr. Roos, thank you for your testimony. Committee, this is the only proponent testimony. We will open up for questions. Just a quick one for myself. Being from a small town, not a metropolitan area like
Sure.
KC, we're not used to naturopathic doctors. So whenever I hear that term, I think of going into the drugstore and seeing these vitamins and all that stuff. Tell us the difference between a naturopathic doctor and an MD. What makes you guys different?
Right. So I didn't want to go, I mean, obviously I had a long testimony to begin with, so I didn't want to bombard you with all the information. But if you look at Appendix A, there's an outline of our different philosophies and approaches. So naturopathic doctors, like I said, we're trained in natural therapeutics, which includes, and this is also on page 5, botanical medicine, clinical nutrition, laboratory and clinical diagnosis, counseling, nutritional sciences, and physical manipulation. What we do is we look at the person who's in front of us, and we're looking at how can we get this person to better health, right? We're not just looking at the symptom that they're presenting with, which is important for management. And when a patient is in a significantly acute situation, that's a different situation. But for especially diseases of lifestyle, we're trying to intervene with the patient and provide therapies that are low cost, low risk, and improve their overall health. So yes, we utilize supplements. I utilize herbs. I'm one of the only providers that are trained in nutrient drug-herb interactions. The goal is to get people so that they don't need significant interactions, that their diseases are well managed and they feel good. And so that's the ultimate goal of naturopathic medicine. What I sense that you allude to in terms of the health food store. So what is often considered in this community is traditional naturopaths. They actually are not legal and able to practice in Kansas due to the confusion. So someone who is an untrained lay naturopath is not able to provide medical consultations without this specific training. Unfortunately, like you said, you're from a small city in Kansas. There's not a lot of naturopathic doctors, especially moving out west, largely because of the issues that I brought at hand.
Senator O'Shea.
Thank you, Mr. Chair. Thank you for being here. You discussed that you have the training to do these things, but there's limits
Right.
and statute. So I was just curious, why is it limited? Why haven't you already been able? What's a little bit of the context as to why this has been limited?
Right. So with initial registration and licensure, we face significant opposition to our ability to treat according to our training. And so with the desire to get started, I guess you could say 20 years ago, the goal was to just get licensure. And so we've been slowly making progress. And that's why we're here today asking for scope expansion.
Senator Petty.
Thank you. And Dr. Roos, how many naturopathic doctors are there in Kansas?
There's currently just over 20 licensed and active naturopathic doctors, to my knowledge.
And are they mostly in what? In
metropolitan areas, absolutely.
Okay, thank you.
Senator Stephan.
Yes.
I'm going the wrong direction, aren't I? I'm hitting it. I'm just hitting it the wrong direction. It's the blue light. I'm colorblind. Well, now I lost my train of thought. Thanks a lot. Okay, so it's always an undergraduate, always a bachelor's degree.
Yes.
How many of these training schools is there?
There's currently 4 schools in the United States, and there's 7 in the greater Northwest, or the North America. One of the schools has 2 locations.
Okay, okay. How many people do they graduate a year?
Depends on the school and the program, but generally, I would say 100, 150.
And so it's your 4 years. It's basically your didactic and your in the field training all together. You
Right.
don't do a residency.
So currently, residencies are not required for state licensure. There's the undergrad program with prereqs, and then the medical program, yes.
Very good. Your Appendix A, the 6 principles, those were certainly always my 6 principles too. Yeah. Thank you.
Yep.
Senator Gossage.
Thank you for being here. So you do say ND, so you are considered a doctor, but not considered a medical doctor. Is that right? I'm just trying to get this straight in my head.
Correct. So from in the medical, I guess, jargon, naturopathic doctor is what I would refer to myself as. MDs are medical doctors, or sometimes referred to as allopathic, and then DOs are considered osteopathic doctors.
And my daughter-in-law, who's a surgeon, was explaining to me one time, because I asked, what is the difference between MD and DO? Is one lesser than the other? And her opinion was, no, they just go down a different track to kind of get to the same. Does that sound right to you?
Yes, the underlying philosophy may be a little bit different in terms of how they approach a patient, but ultimately the goal is best patient care, and it's just come at from different angles. So the same thing with naturopathic medicine. Our goal is best patient care, but we come at it from a different angle.
Then I'm a health insurance agent, and I have clients that swear by their naturopathic doctor, and like, my doctor helped me because of this or that. So it seems to me that primarily as an ND that you are working on being proactive, working on their health, immunization, making sure that they have built up their immunities, et cetera, as opposed to waiting to them to see you when they get sick. Is that accurate?
Yes, that's one of the keys. I mean, one of the principles of our medicine is prevention. So we are often talking about, what are the things that we can do best to provide the tools for you to have the best preventive care. Unfortunately, a lot of my patients come to me already in a chronic disease state. So it's about making the dietary, lifestyle, supplemental interventions to get them to health and then keep them there. But ultimately, that is the goal, is prevention and optimal health.
And finally, Mr. Chair, I know women who are in their menopausal years who go in for bioidenticals. Is that something that you do as well?
Under current scope, no. Is that something I'm trained in? Yes.
Thank you. Thank you, Mr. Chair.
Senator Steffen, blue light.
Blue light, thank you. Blue light special. What would your definition of a minor office procedure be?
So that's usually incidental cares to superficial lacerations and abrasions. So bandages, those kinds of things.
Sutures?
I believe that is included in these current statutes, although there's no surgery. So if it's coming in with an already cut, potentially, but generally no, if that makes sense.
Do you suture laceration?
I have not sutured while in Kansas, correct.
Thank you.
And I do believe that our reviser has some information to give us. So, Jenna?
Thank you, Mr. Chair, and I apologize, Senator Steffen. I forgot that this was already in the bill. In one of the amendatory sections on page 21, subsection G, it does define minor office procedures to be care and treatment to superficial tissue, lacerations, abrasions, and lesions, removal of foreign bodies located in superficial tissues, like taking out splinters, things like that, not involving the eyes, nerves, veins, arteries beyond superficial tissue, may include things like antiseptics and local anesthesia, but not suturing, repairing, alteration, or removal of tissue, or the use of general or spinal anesthesia. So it is defined in the Naturopathic Act already, and it is amended in this bill.
Committee, not seeing any further questions. This will conclude our proponent testimony. We will now move to our opponent testimony. We have one in person, Rochelle Columbo with KMS and the Kansas chapter of American College of Gynecologists. And I would direct your attention to the two written only opponent testimonies. Rachel, welcome to the committee.
Good morning, committee. I'm Rochelle Columbo. I'm the Executive Director of the Kansas Medical Society, and I appreciate the opportunity to be before you today. And on behalf of both the Kansas Medical Society and, as the chairman indicated, the Kansas chapter of the American College of Obstetrician and Gynecologists. Before I begin, I just thought I would back up something that we haven't done a lot before this committee, either last year or this year. Is talk a little bit about the Kansas Medical Society. We were formed in 1859, 2 years before Kansas became a state. And the reason that the Kansas Medical Society was formed was for one purpose, and that was to ensure that Kansans had access to medical care by a physician. The definition of a physician, I know most of you were talked about yesterday, is one who can provide medicine and surgery. And they are the only ones in statute that are allowed to do that because of their training and education. One of the things we haven't spent a lot of time talking about is, and I think that the proponent did an excellent job talking about her scope and about her training and education. They are different in all of these professions. We have a philosophical difference. We fundamentally believe that training and education matter and that they do translate into a difference in patient care. I know most of you received these yesterday, these wheels that talk about the difference. And these are all important healthcare providers. They all are part of a team. They provide different services. They sometimes have overlapping services. And we believe they're all critical. And these folks work really well together out in the real world and for patients. And they do important things. But their training and their education is different. And what is the charge of this committee is to determine whether that training and education is sufficient to allow them licensing and privileges and how those are limited. And, you heard yesterday that when things have been before you for a long, long time, that it's time to move them out. We've been here for a long time. The Kansas Medical Society, not me, has been here since 1859, and our mission is the same. We believe that medical care should be delivered by a physician because they are trained and educated to do so. We do not believe that medical care should be delivered by a non-physician outside of physician involvement. So, I would tell you that we do not believe that Senate Bill 274 appropriately limits that because of the training in pharmacology. You heard there's a difference in training and a difference in philosophy that underlies allopathic and osteopathic medicine and naturopathic doctors. Naturopathic doctors have a doctorate in naturopathy, much like you can get a doctorate in nursing. They are not physicians. There's a difference in the services that they are trained to provide. We don't believe that prescribing should be outside of medical supervision. So we do not support this. You also heard that this has been something that's come before this committee many, many times for much longer than 20 years. There have been scope battles on this issue and on all of these different healthcare providers. Sometimes that's because the training changes. And sometimes that's appropriate to then say, you know what, the training has evolved in this area, and we believe that it now reflects a greater ability to provide those services. This bill does not include different training or requirements. It just expands the scope. So we don't support that. I'll tell you that there was a question about the ability to order diagnostic tests. That was granted, I believe, within the last 2 years. So just changing someone's scope doesn't mean they won't come before you again. They will. And we will continue. We'll be here for the next 20 years and probably many more after that to let you know that we continue to believe that physicians should be the head of the healthcare team. I submitted joint testimony on this bill and Senate Bill 274, but I'll be happy to return to the podium for that, and I am happy to stand for questions.
Rochelle, thank you. We will open up for questions, committee. Rochelle, I have a question. Again, going back to my small town mentality, you used the word physician. Is an ND not a physician?
They are not.
They're not considered a physician?
No.
Okay, thank you. And can a MD or DO do naturopathic?
They are not trained in the same things, no.
Okay. So, and a naturopathic cannot do what an MD or DO can do, but the scope of practice that they're wanting to expand is it strictly prescription Because
I
Or is there some
appreciate that.
extra?
There's a little bit more. The bill, the way that it's written, there was also a question about minor procedures and how that was amended, and it's a little bit different than what's under current laws. One of the things that they've asked to do is to be able to use speculums. That's rather invasive. But for those of us who know what speculums are for, that's pretty specific. So that would be an addition. That would be, they are currently prohibited from obstetrical care, from invasive procedures, from, they have limitations on their minor office procedures, and they're trained in, as you heard from the proponent, in natural healing and in natural remedies. This would allow them to use pharmacological products to prescribe. And so, yeah, it's significantly different than what they've had under their current statute.
Thank you. Committee, further questions? Senator Stephan.
Thank you. Is there any discussion in your academic world that medical doctors at this point, a great percentage of them are being overtrained? Because they basically are on a track now that they're all trained to be researchers, of which a huge percentage of them are never going to go into research. And then they end up coming out with hundreds of thousands of dollars in debt, angry, disillusioned, disenchanted, and then they're put at a competitive disadvantage to other providers. Is there any discussion about that in the academic ivory tower world?
I don't know about ivory towers, but I do appreciate that question. I think it's a fair one. There is a lot of discussion, I think, at large about whether or not physicians are overtrained. The folks that I represent tell me that after their undergraduate education, their medical school education, and then what usually is a 3 to 5 year residency, often followed by a fellowship, they don't independently treat any patients. Not one single patient do they have independent treatment of in any way, shape, or form until they have graduated from medical school. So after 4 years postgraduate, they often say, no, they do not feel overtrained. They feel very, very aware of the responsibility that they have to provide care for patients. Now, do they feel that they're in egregious debt and that it's difficult in this environment for a variety of reasons? Certainly. But I don't believe that physicians go into practice just to make money. There's a lot of ways to make money in this life, and probably getting 15 years of schooling is not the easiest way to begin if you want to go out and earn a high dollar income. So most of them go into this because they feel that it's a calling and they have the acumen to do so. And you're not born a physician, you go to school to become one. That's it. And then you do the work and you go through the programs. So no, I think there's frustration for a variety of reasons with the medical system today and the way certainly that it allows people different abilities in the jobs that they do and in their reimbursement. But no, I don't have physicians tell me they feel overtrained. They say that they take their duties very, very seriously, and that oftentimes those first years in practice are terrifying as they hold the weight of someone's life in their hands.
So staying in a Holiday Inn Express is not a qualifier?
I'm afraid not.
Thank you, Mr. Chair. Thank you, Rochelle. You know, oftentimes in these types of bills, the Kansas Medical Society will come with, we're fine with this part, but we don't like this part. We're okay if they expand their scope here, but not here. Do you have any of that for us today?
Yeah, I appreciate that question. We haven't had any conversation with the naturopaths about this bill before it came up. Normally we do. That's normally often when folks are looking to expand, they come to us and bring those bills in advance, and we talk about them and say, well, you know, tell us about the training that's changed, or tell us what's different here that would, you know, provide for this. We haven't had those conversations. This bill's a little bit of a mishmash. It kind of weaves through their current statutes and changes a lot of things. For instance, you know, it allows those injections into the muscle joint and say the shoulder. It allows the use of a speculum. It allows for prescribing, but there's really no differences that are reflected in the bill about training or education. So I would say no, I don't think that we've had those conversations or that there's a simple fix. We just oppose it and think that it's not appropriate at this time.
Have you had conversations in the past?
We have.
But this bill is different, so
So for instance, they came to us a couple of years ago and talked about why they wanted to be able to do diagnostic testing, that they weren't going to interpret or request the ability to interpret, but they wanted to be able to order tests. We don't feel that likely is going to result in higher costs, because if tests are unnecessary because they don't have the training to determine if that's necessary, that results in a higher cost to the patient, but it doesn't harm the patient either. It's a cost. It's really a question of whether they want to pay for that test, and so we didn't stand in the way of that.
Thank you, Mr. Chair.
Committee, I do not see any. Senator Petty.
Rochelle, I had to see that blue too. I should have looked at Senator Erickson to make sure I blue. I noticed on the list of other states and whether allowing independent practice or not. And so I should have asked this earlier of Dr. Roos, but I noticed that, like, for example, in Maine, they have independent but 1 year of supervision required. So are you familiar with where they?
I'm not familiar with that, and I guess I didn't view this as an independent practice. Naturopaths practice independently. They have a scope that's very different than what an allopathic or an allopathic or osteopathic physician does. And again, they're not physicians, they're doing natural remedies. So they're able to do that. The only areas that require physician collaboration as required by law are those, again, where there's crossover into medical practice. So again, on referring or interpreting tests, those kinds of things. And then they haven't had pharmacological prescribing. So I wouldn't view this as independent practice. They already have that. This is a question about whether they're allowed to practice in medicine.
Okay, I'll ask that question. Or the other
I'm not familiar with the main law.
Thank you. It wasn't fair to ask you.
All right, committee, seeing no further questions. Rochelle, thank you for your testimony. Committee, we do not have any oral neutral testimony, but we do have one written. This will now close our hearing on Senate Bill 274. We will now open the hearing on Senate Bill 275. We are running low on time, so conferees, if whenever you come up, if you could keep it especially short, we could get through this hearing. But first, on 275, bill overview with Jenna Moyer with the Revisor's Office. Thank you, Jenna.
Thank you, Mr. Chair, members of the committee. Senate Bill 274 would add naturopathic doctors to the list of medical professionals that are allowed to have a certificate of authorization to practice, or as a business entity, to practice medicine. And a lot of this that you see in amends in Section 1 and amends KSA 17-2710, a lot of that is just cleanup of the numbers, the way that we designate numbers to make it just more understandable. But it does add, and you will see this on page 2, it adds, this would be B, subsection B, 1, capital E, the naturopathic doctors, as well as in section 1, it adds that designation to allow naturopathic doctors to, we call it the corporate practice of medicine. And this is similar to Senate Bill 539, a bill introduced this year, but Senate Bill 539 also adds acupuncturists as entities that are allowed to have one of these. The shorthand is corporate practice of medicine, but the longhand is the certificate of authorization for a business entity to practice medicine. I'll be happy to answer questions.
And Jenna, my question would be, this is 275, not 274, correct?
This is 275, excuse me, I'm sorry. Yes, Senate Bill 275.
Thank you. Committee, any questions for Jenna? Not seeing any. Jenna, thank you very much. Committee, we will now turn to our proponent testimonies. First up is Dr. Laura Roos. And if you could keep it within 3 minutes, that would be perfect. Thank you.
Yes, thank you, Senator Hildebrand. And as we discussed earlier, naturopathic doctors are currently licensed medical professionals that practice in the state of Kansas under the Board of Healing Arts. Omission from the corporate practice of medicine, KSA 17-2710, is an oversight with original licensure. The current statutes exclude naturopathic doctors from combining with other licensed professionals. If you read the original Naturopathic Doctor Licensure Act, it outlines specific instances in which a physician and naturopathic doctor would be able to collaborate. Unfortunately, exclusion from this bill makes it so that it's a technically very gray area for practice. So we ask you to support this statute as it supports a working relationship that naturopathic doctors and SB 539, our professional colleagues, licensed acupuncturists, so we can work collaboratively with other Kansas licensed professionals.
Dr. Roos, thank you very much. We have one other proponent. We'll hold questions for the end. Next up, we have Sandra Wilkes, President KSAOM, but it looks like it's presented by Kevin Barone. So, Kevin, welcome to the committee.
Thank you, Chairman, members of the committee. Sandra Wilkes could not be here. I'm just here to go ahead and let you know they support being included in the core practice of medicine. You see her written testimony, and it's kind of along the lines of what Dr. Laura said, with everything in terms of being able to expand their scope, expand what they do, not their scope, and working with other doctors.
Kevin, thank you for the testimony. Committee, do we have any questions for the conferees? Senator Petty.
Thank you, Mr. Chairman. And Dr. Reyes, would you come up here for a second? I'll ask you two questions. One, the question that I should have asked a little bit earlier. So when I looked at that chart of other states, and it talks about independent and then 1-year supervision, who is that supervising in other states? Do you know?
I'm not certain about the intricacies of Maine law. We are in Kansas independently practicing, and that's largely because of our training is quite different from that of MDs and DOs. If I were to recommend an intervention that they're not commonly affiliated with. For example, if I use an herb such as passion flower on top of another sleep medication such as hydroxyzine, most MDs or DOs are completely unaware of patient or of interactions of drug, herb, nutrient herbs. And so for them to be able to supervise that, it's beyond their training, and it would be a lot to ask for an MD or DO to oversee something that we do in terms of patient management with that. This allows for us to collaborate with them within the same business entity, which is what we're looking for. Yep.
Okay, just in a follow-up, so
Yep.
There was testimony that was provided by Susan Gill, I believe, and that has a naturopathic doctor in her practice, I think.
Which
Susan Gill, maybe that was the wrong.
that's an.
Okay, there was, as I was reading through the testimony, there was testimony that of support for, and so currently there are some naturopathic doctors that are working with MDs, and so are they doing that without?
So I believe you're referencing Dr. Kristen Watkins, which is the overseeing physician for our immediate past president, Alicia Johnson, who left Kansas in order to provide care under her scope in a different state. So that's what that is essentially speaking to. From my understanding, she is a licensed physician in both Missouri and Kansas, but the naturopathic side is only in Missouri because of that limitation.
Thank you.
Senator Stephan.
Thank you. An observation I'm going to try to put in question form.
Sure.
Draw attention to the Kansas Association of Osteopathic Medicine's written testimony by Vicki Whitaker. At the very bottom, her complaint is in regards to SB 275 is that it would, by being an employee of a corporation, that would create a conflict of interest for the employer and employee. Then says a physician or other healthcare workers are dedicated to the patients they serve while the employer is focused on the bottom line. It has been my observation that part of our problem in healthcare is that we have all these medical doctors, DOs, who are employees of hospitals. Isn't that the same conflict that the executive director of the Osteopathic Society is stating as well? Is it any different?
I mean, so what we're looking for is to be able to work with MDs and DOs. I can't speak to the unfortunate instance in which other providers and physicians are under the purview of hospitals, possibly not to the base of the patient benefit.
I apologize for asking that in question form. I find it incredibly ironic that an executive director of the osteopathic group claims that there's a conflict of interest when the members of her society are overwhelmingly employees as well.
Right.
All right, Dr. Roos, I see no further questions. So committee, we will now turn our attention to opponent testimony. We have one oral and one written. The written should be online or in a packet. So Rochelle Columbo with KMS is the opponent. Rochelle, welcome back.
Good morning again. I'm Rochelle Columbo, Executive Director of the Kansas Medical Society, and just representing the Medical Society on Senate Bill 275. I appreciated hearing from the proponent about the goal of why they'd like to be included in the corporate practice of medicine. For some background, this will be shocking to everyone, that in 2019, when the corporate practice of medicine prohibition was changed, it was, and I know Senator Holscher can attest to this because she was a member of the House committee at that time, it was a very controversial bill. And the crux of the issue is what Senator Stephan asked about, that question around why do we have a prohibition on the corporate practice of medicine? And the Kansas Medical Society has been opposed to that. And the reason is that there is a feeling and a belief that a physician should always be held to independent medical judgment. It's something we've talked about in this committee a lot. You'll be working on it, I believe, later on House Bill 2280. Independent medical judgment is important. And again, it goes back to our philosophy that the training and education inform that it should be one-to-one between the patient and the physician, and that there should not be another interest that's influencing the way that care is provided. There are exceptions to the Corporate Practice of Medicine Act, including hospitals. Hospitals are required to have medical direction. Medical direction, the teams that make up medical direction are made up of physicians, and they have an exception in their corporate code to allow for the corporate practice of medicine. That aside, which has always been the case, in 2019, the Corporate Practice of Medicine Act was expanded to allow for other entities to directly employ physicians. Prior to that, they could contract with them, but they couldn't directly employ them. And without getting into the details of that, I just want you to know it was a really, really controversial bill. The proponents, which were Cerner and the Kansas Chamber, the opponents, which were the Kansas Medical Society and KOM, worked together to come up with a compromise and to say, you know what, there's a little bit of a distinction without a difference. If we're going to say that a physician can either contract or be employed, let's just make sure that the same rules apply. Again, we've been around since 1859. Our philosophy hasn't changed. We think that this is a matter of fairness, and that if we are going to hold ourselves out as providers, that patients have a right to receive the same care and to have their providers held to the same standards. And so what they did when they changed that in 2019 was say that corporations that were engaging in the corporate practice of medicine had to be held to the same standards under the Healing Arts Act for ethical conduct. So that gets me to why we oppose having the naturopaths included in the bill. And it would be this. If you take the two combined and you expand the scope of practice of a naturopath to include the practice of medicine, and then they're allowed to be directly employed by a non-physician entity, we believe that that won't result in good care for patients, and they won't have the same right of recovery. It's about fairness. We don't think it serves patients well. It's a very complicated issue, and I would really be happy to talk with folks longer, because I do think that it's important and it deserves some consideration and study. And to her point, if the goal is to make sure that they can collaborate with physicians who are under corporate practice, I'm not sure what would prohibit that. But if the goal is to make sure they're collaborating, that's a good goal, and we would support that. And so I'm just not sure I understand why they have to be included in the Corporate Practice Act to achieve that, but we'd be happy to have that conversation.
Committee, questions? Seeing none. Thank you.
Thank you.
Committee, there are no neutral testimony, so this will close the hearing on Senate Bill 275. We are out of time today, so without any further ado, this meeting is adjourned. Thank you.